Suppose I got my health check done.
Yes.
And I open my report.
Yes.
So what are the first few parameters that I must look into?
I would say I'm interpreting one CBC, complete blood count, also known as hemogram. So I would say focus on the leading values, something like only hemoglobin,
Achha.
then WBC count and
Achha.
platelets. If these are normal, don't go into the details.
Okay.
That may worry you further, because that is the work of a physician to interpret them properly. If the leading values are okay, relax. Vitamin D, which is quite common these days, the value is very important. LDL value among the lipid profile is very important.
Achha. Everyone needs a multivitamin every day, myth or fact? Because people are popping multivitamins like
Agreed.
mouth
Agreed.
refresheners.
Yes, yes, yes. It's definitely a myth. Beyond that, not knowing the content of your multivitamins, which
Acha.
may contain sometimes very minuscule levels of lot of ingredients put into one, or deficiency of one parameter what you are having, and the supplement doesn't contain that factor.
Acha.
So this should not happen.
Most of us open our health check report and instantly scan for red marks. But very few of us know what actually matters. Behind those numbers, 60, 70 numbers which we are talking about, only a few handful truly reflects your long-term health, disease risk and daily habits. Some values look alarming but are harmless, while others may appear borderline yet have serious implications. Interpreting a report isn't about memorizing ranges, it's about understanding the story of your body, which it is trying to tell you. In today's episode, we simplify your health checks. Yes, what to read first, what to ignore, and what absolutely deserves your attention. Joining us today is Dr. Madhav R. Dharme, highly respected internal medicine specialist in Pune, bringing over 15 plus years of experience from Sahyadri Super Specialty Hospital, Hadapsar. A graduate of MUHS Nasik with a DNB in internal medicine, he is widely regarded for his sharp diagnostic acumen and evidence practice. Dr. Dharme has extensive expertise in managing complex and chronic medical conditions, including diabetes, hypertension, cardiovascular diseases, metabolic disorders. His commitment to continuous learning and active participation in research and contribution to national and international medical forums reflects his dedication to advancing patient care. Known for his compassionate and patient centric philosophy, Dr. Madhav Dharme stands out as one of Hadapsar's most trusted physicians, delivering comprehensive and personalized medical care. Welcoming Dr. Madhav Dharme. Hello and welcome to Sahyadri Health Talks. I'm Dr. Shita, and today we have with us Dr. Madhav Dharme. Hello, sir.
Hello. Hello.
How are you?
I'm fine.
Welcome on Sahyadri Health
Thank
Talks.
you for having me here.
How does it feel to come here finally?
It's great. It's great. It's great. And particularly the purpose, that is really appreciable.
Thank you. Thank you for finding out some time for us. So today we are going to talk about health checks and what do they really mean. So there are
Yes.
so many parameters in health check which we often see.
Correct.
So as a layman, how do we interpret those and what do those parameters really say? So earlier health check was meant for after a certain age it needs to be done, but thanks to the awareness and more and more people are knowing the importance of it. I think people start health checks quite early, maybe in their 30s, and also because of this corporate culture which is coming up in Pune or in other metro cities as well, there's employee health checks which are being offered. Now what happens is, typically when a person gets a health check done, it's a bundle of papers which comes to them,
Correct.
or through mail, and there are so many parameters which
Yes.
they see, and some are all they see look out for is the bold ones which are the
Yes,
abnormal
correct.
ones.
Correct.
And though some might be alarming, they feel that it's okay to be in that level.
Agreed.
So that's our topic of discussion today.
Yes. Yes.
So talking about health checks, so how have you seen the shift of these patients and this particular age group? Earlier it was, as I said, it was more towards geriatric population. How do you see our this change of age,
Correct.
shift of age happening?
Yeah, that's fine that we check these tests at earlier age. I often tell my patients and their relatives.
Do you see
those
more patients now who are
Yeah,
young and
definitely.
coming for
Yeah,
testing?
definitely.
Okay.
Because of whatever may be the reason, for their insurance purpose or for their job joining, they are getting tested. So it's good because whenever the patients they come with their parents and all, their parents are almost means all of them are deceased, and their children in their 25 or 30s. I often insist them to get the things checked, because sometimes people say that they are scared of getting tested, because if something comes problematic or some disease, if they come across, then that scares them. But I tell them that these tests are like your binoculars, and if you are catching the enemy from a distance, it is easier to tackle,
Yeah.
rather than tackling it when it's at your doorstep.
True.
So tests are not your enemy, they are your weapons. So that testing them as early as possible is always good. But if you ask me about protocol, there are no such protocols that these tests to be done at 25 age or 20 age, whatever may be the reason. I would like to classify them in two: that if you are if you're
At
talking
risk.
about preventive health
Okay.
checkup, so certain basic tests they are good at even at 20 age or 25 age, age of 25 years. And if you are talking about a already deceased person, then preventing the complications of that disease,
Acha.
so that is equally important. So there should be certain focus test, those who are already having a certain kind of
Certain
disease,
conditions.
certain condition.
So, as you said that, knowing your enemies or seeing your enemy from a distance is always
Yes.
better because you are more tackled.
Yes.
So, I suppose I got my health check done.
Yes.
And I opened my report.
Yes.
So, what are the first few parameters that I must look into,
Correct.
to understand where I stand?
Yeah, definitely. Knowing about your own health is always good. Don't feel that the doctors will get annoyed if you are interpreting it. No, doctors are happy that you know about your health and you are asking questions, asking queries about all the details. But don't get obsessed about certain figures. Something like, if I would say I'm interpreting one CBC, complete blood count, also known as hemogram. So I would say focus on the leading values, something like only hemoglobin,
Acha.
then WBC count and
Acha.
platelets. If these are normal, don't go into the details.
Okay.
That may worry you further, because that is the work of a physician to interpret them properly. If the leading values are okay, relax. Visit your doctor and they will explain you the further details. If there are minor values here or there, under them, under those headings, something like differential counts or morphology of that particular RBC, these things. Then vitamin D, which is quite common these days, that Indians are quite deficient in
Yeah,
vitamin
I
D.
do have a question on that also. Vitamin D
Correct.
and B12.
Correct.
Yeah.
So something like CBC, vitamin B12, D3, HbA1c. As
Acha.
we all know, sadly, the India is known
Slowly
for
becoming the diabetic
capital
capitals
of
of the world.
diabetes mellitus, and so HbA1c value is very important. LDL value among the lipid profile is very important.
Acha.
If you are already on certain medicines or you are hypertensive, then uric acid number carries a lot of value.
Values.
Urine routine, seemingly neglected thing, but if you are getting proteins into urine, so this urine routine examination is also important. So this is, I would say, I would like to enumerate these things as CBC, urine routine, uric acid, HbA1c and LDL. These are the leading parameters. I would like that everyone should focus as soon as they
Get a
get the
report.
reports.
Okay. So when we talk about these reports and the datas, right? Some values which you often see are abnormal in Indian
Yes.
population, but can be easily reversed through lifestyle or diet. What would be
Definitely.
those values?
Something like, particularly in women, hemoglobin value. It is these are many instances that we come across hemoglobin of 10, 9, and they say नहीं मेरा इतना ही रहता है. इतना ही रहता है doesn't make you normal. You have to go into the depth of that cause behind that. There are certain conditions where your hemoglobin may not rise beyond 9, something called a thalassemia trait or something like, but you must conclude with certain further tests that you have got that condition and it is not going to rise.
Acha.
Don't take it for granted that मेरा 15-16 की उम्र से ही हीमोग्लोबिन 9 रहता है and it is not rising, though I am eating healthy diet and all. And
But
at the
don't
age of,
forcibly generalize an abnormal value.
yes, don't forcibly generalize. On the other hand, you are worried about the parameters below that, but you are not focusing on the hemoglobin, which is the leading value, and it is obviously undercorrected. Sometimes in anemia, only the diet may not be enough. You
Acha.
need a pulse therapy or say a replacement dose of iron, and then you are good to go with only diet management. So I would say that while interpreting as small as hemoglobin value, that should be, that should not be, as you said, forcibly generalized. You should go into the depth as per your
And it can be
physicians. Yes, it can be
reversed.
reversed very easily, but you should stick to that protocol. You should recheck after replacement. If
Acha.
it is not getting replaced properly and your values are not returning to normal,
Okay.
you should search for the cause.
Okay. So
Which may
hemoglobin is
include
one of those.
yes,
Okay.
correct.
What would be the other parameters?
Second, in lipid profile, LDL, as I said, sometimes we are genetically prone for dyslipidemia, known as familial dyslipidemia. But beyond that, there are lifestyle changes which can correct your LDL very easily. Over a period of 6 months, you may find the difference.
Acha.
Then coming to, as we said, diabetic capital, India, HbA1c value, if you catch it early, at the age of like at the value of 5.9 or 6 when you are pre-diabetic, that can be easily reversed.
Of course.
This diabetes reversal is coming in a very big way.
Yes.
But you should be prudent enough to catch it early. If your HbA1c rises up to 7.58, and it's very difficult to reverse it,
Yeah.
because beta cells of your pancreas, they get exhausted. So no matter what you do, but
so there's no point catching it once it reaches
once it has
too
reached.
high.
Yes.
Okay. So next is, there might be some parameters which are mild, which show mild abnormalities.
Yes.
And people might ignore saying that, mildly ऊपर है या नीचे है, but it is actually not that casual thing. Do we have any parameters like that as well?
Yes, correct. Something like uric acid level. The mild, like something like if your lab parameters are showing that 6.5 is the maximum cutoff value and you are getting 7, you must search for the cause. You might be having something called as occult hypertension, which you are not measuring it and you are not catching it. Then in simple urine routine examination, if you are getting RBCs, red blood cells, those are not normal in any case.
Okay.
And in such situation, if you are getting urine proteins positive repeatedly on repeated testing, I'm saying, after ruling out certain basic causes, if you are persistently getting urine proteins, that is very important, which you may focus on the 1+ number. But at 1+ is also important when it comes to urine proteins.
So these are a few parameters. Even if you see mild abnormality,
definitely,
you should reach out for
the causes,
the cause and help. Okay. HDL, LDL, triglyceride. How should a layperson understand and interpret these?
Correct. Triglycerides are closely related with your carbohydrate intake, your level of HbA1c, and your level of physical activity, exercise, triglycerides. But though the numbers are striking, I would say it's an innocent parameter. It's just an alert that something is going wrong. If you don't correct yourself at this juncture, then LDL is going to rise,
which is the bad protein.
Which is the bad lipid.
Yeah.
And that LDL is a very big parameter for your
so
cardiac
even
health.
A slight or higher level of LDL is marked as risky.
Yes. Not risky, but alert sign that should not go beyond a certain limit.
So which would be certain health parameters or the findings which indicate a cardiac issues? Because of course goes without saying that we are seeing so many increased incidences of cardiac
even at
heart
young
attacks
age.
at young age. Now, in fact, I would say young age is more normal than geriatric population. The incidences are so high. So what would be a few parameters which will be a big red flag to indicate heart. That heart? Yeah, particularly heart.
One, as we just discussed, is LDL, and the other one which needs a lot of awareness is our HbA1c. Because your diabetes is associated with heart disease so closely
Mm-hmm.
that a dictum is, once you are a diabetic, consider that you already had an heart attack.
Oh my God.
You have to go into the secondary prevention of heart disease once you are a labeled or diagnosed case of diabetes. It is so closely associated. The definition of diabetes mellitus itself contains not only metabolic abnormalities
Mm-hmm.
but a vascular abnormality happening in
Mm-hmm.
the body,
Mm-hmm.
leading to further complications. So in general terms we label only cholesterol.
Mm.
लोग बोलते हैं कि it's the fat which
Yeah.
causes the clot,
Yeah.
and they neglect whole scenario of HbA1c. That should not happen.
Mm.
HbA1c is really closely associated with your cardiac health.
Okay.
HbA1c has to be under
Checked.
control as per your age permits.
What about these thyroid levels? T3, T4,
Correct.
TSH.
Correct.
How do we interpret these?
TSH is, many times people don't know, but TSH is thyroid stimulating hormone, which is
hormone.
not a thyroid hormone. It
Mhm.
is secreted by your pituitary
Yeah.
gland
Yeah.
that stimulates thyroid, and that makes T3 and T4.
Mm-hmm.
And if you can associate that as an analogy,
Mm-hmm.
if your body needs fuel, a car needs fuel, that's your petrol.
Mm-hmm.
And but car also has one liquid known as oil, engine oil. So these thyroid hormones, they work as a oil.
Mm-hmm.
You have something called as fuel in your body, carbohydrates, proteins, fats.
Mm.
But your body, each and every cell needs T3 and T4
Acha.
for their proper functioning. So the nature has made such an arrangement that T3, T4, even it grows slightly down,
Mm-hmm.
thyroid stimulating hormone rises.
Acha.
So rise in thyroid stimulating hormone, that is TSH, indicates that something is going wrong with T3,
T3 and
T4. It is
T4.
getting less. So this is the time that you should provide from outside T3, T4,
Mm-hmm.
so that your TSH will come down to normal.
Mm-hmm.
It's a mirror of your thyroid functioning.
Mm-hmm.
TSH value is a mirror because it shows opposite value. TSH is rising, that means you are having hypothyroid, that
Mhm.
means low functioning thyroid gland,
Mm-hmm.
and you should timely reverse it.
Mm-hmm.
If you ask me about the values, then as per your lab parameters, they might vary, but there is something called as subclinical hypothyroidism. Means
Acha.
thyroid TSH level raised a little bit than normal, but not to a level where you should start treatment.
Acha.
At young age, you may find yourself into that range of subclinical hypothyroidism.
Mm-hmm.
But there are certain conditions where you need to treat that subclinical also. Means slightest change of 1 or 2 units, that should not make you complacent that it is, no, it's near normal, it's near normal. No, but if you are having lipid profile which is deranged,
Acha.
your LDLs are high, you are already on antihypertensive medicines, blood pressure medicines, you are a diabetic, or you are at the age of 50 or 60 years of age, you are already having some cardiac abnormalities, you should treat that value also.
Mm-hmm.
So this is how we should take TSH level in that serious note.
Okay. So, as we were speaking about vitamin B12 and vitamin D,
Yes.
which are, we see a lot of deficiencies. So,
Correct.
how many patients in general? I mean, I just wanted to ask you that if you're seeing 10 health check reports in a day, suppose,
Correct.
how many do you see with abnormal B12 and D?
Vitamin D, if all of them are coming with the values, then of course 8 out of 10 I am seeing with vitamin
8
D.
out of T,
Yes,
10.
yes, it's quite common. It's
8
quite
out
common.
of 10 vitamin D deficiencies.
Yes. Those who are not on replacement, of course, all the
Okay.
conditions
Yeah.
satisfied.
And vitamin B12?
B12 is around, I would say, 3 to 4.
3 to 4. So why are we seeing this increased incidences of vitamin D and B12 deficiencies?
This has always been actually the why we are seeing more numbers, means we are getting tested more.
Yeah.
Right. The thing is, being into a hot climatic zone, we cover ourselves more, and particularly the sun rays which are required to convert that fat into vitamin D under our skin, that needs a particular angle of the sun rays that is available during 8 a.m. to 1 p.m.
Okay, so let's break this myth once and for all that anytime you step out in the
Yes.
sun you get vitamin D. No, you get UV rays and tans, but you have to you get those rays only between 8 a.m. to 1 p.m.
1 p.m.
Okay.
Rather, I would say 10 a.m. to 1 p.m.
Acha, 10 a.m. to
Those are
1.
the rays which
Okay.
convert our sources into vitamin D3, and that is the exact time when we all are indoor doing our work.
Yeah.
On top of that, those who are traveling, they are in shade or covered up.
Yeah.
And beyond that, means don't blame ourselves for that. Our skins are so that we convert less. We are like genetically, or we as say certain parameters of our skin, they don't convert that much. That's why we are
Acha.
into that deficiency state.
Acha. So
So
that's the major
that's the
reason.
major
So what
obstacle.
message do you have for all people out there? First of all, I would want to know that how do I know that I have vitamin D deficiency? Does my body show some prominent symptoms?
Not early. That
Acha.
needs a chronic, long-standing vitamin D3 deficiency, which will manifest in your body after around 40 to 50 years of age.
Oh, okay. So,
Beyond 50 years, I would say.
so if my health check report shows a vitamin D deficiency, talk
Yes.
to the physician and get
Yes.
a supplement. So
Supplements.
while we are talking about health checks, right? What would be certain health checks that that must be incorporated? Why I'm asking you this is because there are a lot of name of health checks like advanced health checks,
Correct.
comprehensive health checks,
Correct.
and so on.
Yes.
So, but then these might be very confusing for a layman.
Yes.
So, if you have to tell people, our audience, that if you are above 30, आपको बेसिक टेस्ट तो करवाने ही है, जैसे ब्लड
Yes.
पैरामीटर्स हो गए, लिपिड्स हो गए, लिवर हो गए, किडनी हो गए, बट व्हाट वुड बी अ फ्यू टेस्ट्स दैट people above 30 must get it done, people above 40 or 50 must get it done? So can you give us some must inclusive tests in our routines?
Yes, correct. As per as names given, they vary institute to institute,
Yeah.
from lab to lab.
Yeah.
So, but at the age of 30, I would say hemoglobin, definitely.
Definitely.
Hemogram, HbA1c, because we are seeing young diabetics these days.
Sure.
Lipid profile, and urine routine, as I earlier said, carries very much importance.
Yeah.
And kidney health, for kidney health, creatinine value.
Acha.
So these are just superficial few parameters if you are at young age,
Acha.
provided you are taking adequate care of your body. Something, as we earlier discussed, something like vitamin B12. People say that they are consuming animal products and all, and still why they are developing vitamin B12 deficiency. But on the other hand, they are having excessive tea consumption or
Acha.
probably alcohol consumption that causes B12 deficiency. Even if
Oh.
you are eating healthy, but your day starts with tea and there are repeated tea episodes throughout the day, then no matter how strong B12 supplements you are taking in your
Acha.
diet, that may not get absorbed.
Oh,
Excessive tea
okay.
consumption is a reason behind that.
Oh, acha.
So, or in case of your daily consumption of alcohol, that can cause B12 deficiency. So, if you are into such habit, definitely you should get it checked, so that that is going to means guide you
Okay.
to avoid certain things.
Okay.
That
So
you may
these
come to realization that this
realization.
is the thing, something going in wrong in my daily routine. I should stop.
Okay. Okay. So these are for the young people, like say
Yes.
30 and above,
Yes.
right? What would be some certain must-do parameters for both men and women, or men separately,
Correct.
or women after a
So
certain
I
age?
would say, again, along with these basics, something called as prostate specific antigen, PSA, comes at the age of 40. You
Acha.
should every year you should check.
Acha.
Then along with that, periodically you can go for stool examination also,
Acha.
because if you are having any bowel issues, altered bowel habits, so these days colon cancer is the number is growing in a very big way. So that can prompt for further investigation. You should catch
Okay.
it early. It is
Okay.
very well treatable
Okay.
entity if you catch them early.
Mm-hmm.
So this is something which comes addition to the to your basics, along with lipid profile, HbA1c. They
Okay.
should be checked.
So what about the pap smear in females and mammography?
At above the age of 40 years, you should check them every 3 yearly. If there are any suspicious lesions, then your frequency may increase as per your consultant. They may guide you in that.
Okay, so one thing which we often hear people complaining is, I've done tests in this lab, and I'm very sure people have come and asked you also this,
Yes,
कि
yes,
सर यहाँ पे टेस्ट कराया है, रिपोर्ट तो ये दिखा रहा है
correct,
वैल्यू, वो लैब में करवाया वो तो कम दिखा रहा है. So
correct,
this difference in parameters always exists,
correct.
and it confuses a layman big
Correct.
term. So
I agree.
how does a layman interpret, and what kind of variations are okay?
See, our blood is an emulsion. It's
Acha.
not a uniform liquid like water. That
Acha.
if you take each drop of water, it is going to show you same chemical
Same
composition.
composition, yeah.
Our blood is like milk. So it's a mix of many cells, many other factors. So every drop of your blood varies from the other drop of blood.
Acha.
So even if you draw a blood from a vein and put into two different machines, it can show little variation.
Acha.
That should be acceptable.
Okay.
That's why it is said that these are the ranges which are given, not the absolute values in any lab test. It's a human body, it keeps on changing. On top of that, as I said, every drop of blood is different from the other drop of blood, so we have to respect that variation. But if the variations are too much, something like one lab is showing hemoglobin of 11, the other one is showing 9, generally 0.7 difference we consider. But if that much is difference, then there might be some technical problem in drawing of blood.
Acha.
Or then definitely you should uh, rely on the lab which has got better, I would say, certifications or better technical expertise and all, and let that report get interpreted by your doctor,
by an
expert, by physician.
Okay, so that's about that. Moving on to the next segment, which is a quick, rapid fire and mid bursters. I'll read
Yes,
out,
yes.
and would request you to give us closure on these topics.
Correct.
So the first one is, what combination of findings are true red flag?
Yes.
High sugar with high triglyceride, or elevated liver enzymes with obesity?
Very difficult, because what you are telling is a complex of one disease itself, known
Acha.
as syndrome X,
Acha.
or a metabolic syndrome, what is called as, or you can, in general terms, you can call that as a modern day disease.
Acha.
Because once the triglycerides rise, they can derange your liver enzymes, and that is a product of your obesity, and you are heading towards increase in HbA1c. So all four what you narrated are connected.
Okay.
Even if, forget about two, even if one of them is getting deranged, that's a red flag sign.
That's a red flag sign. Okay. What's one parameter people obsess over unnecessarily, and one parameter they often ignore?
Yes. Obsessed are something like serum triglycerides, and vitamin B12 and D3, which can be easily treated, and the cause lies in their schedule itself of the day or their eating habit.
And one day which they ignore.
Ignore is, as I said, hemoglobin. मेरा तो इतना ही रहता है.
इतना ही रहता है.
So that should not be the reason. That should not be your own diagnosis that इतना ही रहता है means normal. No, it's not normal.
Okay. If uric acid is high but there is no joint pain, is it still a concern?
Yeah, definitely a concern, because we should search for the cause. Achha. For this uric acid matter, I want to come down to something called as blood pressure. Achha. Blood pressure is a normal entity. The disease, rise of blood pressure, the disease is called as hypertension. This hypertension entity is very, very neglected kind of thing. We do blood tests, and we keep them in cupboard, saying that those are normal, and they don't visit any physician or anyone.
Yeah.
What completes your profile is getting those reports
seen by
an expert, along with a general examination. General examination, which constitutes your pulse rate, saturation, your blood pressure, your general auscultation, what we auscultate. We palpate your abdomen. We see you as a whole, as your morphology, of if you are overweight, underweight, all these parameters. Your muscle mass. So these parameters carry a lot of importance along with these blood tests.
So only blood test is never enough.
Never
we
enough.
Need a physical examination.
Yes. That blood pressure is so important, because if you are having something called as family history of hypertension, then there are chances, no matter what kind of lifestyle you do, you may still have high blood pressure, and
Acha.
that can lead to lot of complications
Okay.
that has to be treated medically or pharmacologically with
Acha.
medicines.
Acha. Okay.
That rise in blood pressure, if it is not untreated, gets untreated for few months, that rises that uric acid level.
Mm-hmm.
So that rise in uric acid level is a hint that your blood pressure might be going unnoticed. You should check it repeatedly. Or there are chances that you are not having enough water, or
Acha.
probably you are having more than required excessive intake of animal proteins.
Okay.
These are the parameters. And if you are not getting joint pains and you are leaving that value like that, you may get joint pain within 1 or 2 years, which will be like difficult to treat then afterwards. You may need many medicines.
Okay. So if uric acid is high but there is no joint pain, it is actually a
Still a concern,
concern. So
still a
we have to
concern.
reach out for help. Uh, High calcium or low calcium, which is more dangerous?
uh, Low calcium, I would say, in a long run it is dangerous.
Acha.
High calcium, it is an acute entity. You have to
Acha.
search for the cause immediately,
Hmm.
and you have to treat it over a period of, say, few weeks if not days. And low calcium may not manifest then and there. It may take a toll on you over a period of years.
Acha.
Yes.
Okay. After abnormal results, how soon should the retesting be done? So suppose if somebody got a health check done
Correct.
and saw some abnormal values,
Correct.
so how
They
what should be
should
the
be
gap?
individualized as per the test. Means if it is SbA1c, which is like borderline, as I said, pre-diabetic,
Hanji.
then 3 monthly is a must.
Acha.
If it is cholesterol or lipid profile, as we say, if it is borderline, then I would say 6 months. But provided that those 6 months you are actually changing your lifestyle and doing certain measures to control those little abnormal values over a period of 6 months, then within 6 months you should check. As far as these deficiencies, vitamin deficiencies are concerned, there may not be a requirement of rechecking once you develop that. If you have test evidences that you have got deficiencies, every year you may contact your physician and they may prescribe you with the supplements every year there onwards. So, and as far as simple as hemoglobin is considered, after around 3 months of adequate supplements you should recheck them.
Okay. That's about that. Now the next one comes is only people who eat non-veg get high uric acid. Myth or fact?
Myth.
Okay. If your report shows low calcium, drink more milk and you're sorted.
No, not at all. That can create even trouble with
Okay.
your iron absorption. If you drink a
Acha.
lot of milk, your iron may go down.
Acha.
Yes.
Okay. Okay. Everyone needs a multivitamin every day. Myth or fact? Because people are popping multivitamins like
Agreed.
mouth
Agreed.
refreshness.
Yes, yes, yes. It's definitely a myth. Beyond that, not knowing the content of your multivitamins, which
Acha.
may contain sometimes very minuscule levels of lot of ingredients put into one, or deficiency of one parameter what you are having, and the supplement doesn't contain that factor.
Acha.
So this should not happen.
Okay, so that's about that. Now, before we let you go, we have a ritual where we ask our doctor to share some story which has been really challenging and
Yes.
very close to your heart, maybe,
Yes, yes,
which
yes.
has left a mark, in your memory.
Definitely,
So,
definitely.
please share some stories
Uh,
with us.
there was a lady around 50 years of age and seemingly absolutely normal, doing her normal work, and landing into emergency department with chest pain.
Acha.
Over a period of time, means last 1 hour she was having chest pain, and that was excruciating, something like something tearing inside.
Acha.
uh, we did ECG was perfectly normal. Within few minutes we did her cardiac enzymes, which is a normal thing to be done in case of chest
Chest
pain.
pain.
With a normal ECG we did those tests were normal. Still she had that, and into the history we noticed that she slowly was developing irritability along with that chest pain.
Acha.
In medical science, there are, while we make our diagnosis, we put something called as differential diagnosis. It is never like one diagnosis, and if it is not, then it is nothing else can be.
Yeah.
So as far as chest pain is considered, there are differential diagnoses that this can happen, this can happen, this can happen.
What are the probable
Of course,
things
yes,
which can
lesser
happen?
the probability, lower is the differential diagnosis.
Correct.
So as far as her symptoms were concerned, along with that, she was developing that altered sensorium kind of thing. So that prompted us to do an CT aortogram in her.
Acha.
The probability of which was very less, but definitely not nil.
Acha.
So we did one CT aortogram within few minutes of suspecting it, within say few minutes of her landing into the emergency department, and we found that she had something called as aortic dissection. Aortic dissection is an entity where the aorta, this is the major biggest artery arising from the heart, and then onwards it gives branches to different organs.
Yeah.
That aorta gets a tear from inside, and that flap starts forming over a period of time, and the blood keeps on going into that false lumen. And because of that flap, the blood supply to the other organs starts getting hampered. So her blood supply to her brain was not getting proper. That's why she was getting those mental symptoms, which can be easily neglected if other parameters are normal, and we may label that as something like some psychological disturbance or something. But within few minutes, we suspected that, we did an aortogram, and she was subjected to further procedure within time, and she was put in with a big stent. Some, like you must be knowing, cardiac stents are very small, but aorta is very big, and that's the biggest artery, and that also can be stented. We stented her, and that seemingly fatal incidence was prevented with that. While doing that, because of compromised blood supply, her kidneys were getting hampered. Her creatinine value was within that R. It was started getting building up.
Yeah.
So we had to take that risk of creatinine, and still had to give her contrast injection to look for the correct aortogram. And we took that risk, and the catastrophic complications were prevented.
And how
there
soon
onward.
she could revert back to her normal life?
Say within a day or two, she was out of intensive care unit, and over a period of next 3-4 days of observation and correct blood pressure, she was discharged. Why this is very close to my heart? Because this gives the importance of your regular checkup with your doctor for your blood pressure. As small as a blood pressure parameter, which can be easily tested. Uh, if she would have gone through similar investigation along with her doctor's visit after the age of 35 40, at the age of 50, she would have not got into this seemingly fatal episode. Because of her blood pressure, uncontrolled blood pressure over a period of few months, she started getting that dissection, and that sudden spike in blood pressure was the cause
Major
behind
reason for this.
major reason for this problem.
Okay.
So this blood pressure should never be neglected, and the other take home message is no chest pain should be neglected.
So thanks for sharing that, inspiring case. And before we end our podcast for the day, what would be your final message to all our viewers?
Message would be that getting tested is your own weapon. Don't consider that as enemy, because that is going to lead you to a certain action which is going to prevent your disease. And the second entity is getting investigations done, and keeping that file into the cupboard won't do much. You have to get it
Interpreted
by an expert, by a physician, and get yourself examined. Not only blood parameters, but certain examination findings
Physical
also, they are equally
examinations as well.
important, and that should be a regular activity beyond the age of 35, I would say. And that's my message.
Thank you, sir, for this beautiful session. And thanks for giving us this time today.
Yeah.
On that note, this is Dr. Tushita signing off, Sahyadri Health Talks.